Hi, so my name is Alexandria Silva, and my presentation for Dr. Bray's poultry management class was on hazard analysis critical control points, which is also the HACCP. So what is the HACCP? It is a management system in which food is safely addressed through the analysis and control of biological, chemical, and physical hazards from raw material productions, procurement and handling, manufacturing, distribution, and consumption of the final product. It is a framework that we use to monitor the entire food system from harvesting all the way to consumption. And the reason we do this is to reduce the risk of any foodborne illnesses. That's really the goal of this entire program. These illnesses or hazards can be introduced through just about any process, equipment, environment, and even by employees. So this is a system that has been adopted by multiple agencies. And we kind of see this system in place anywhere we look that food is involved. So HACCP does not work alone by itself. Alone by itself, it's not very efficient because you need all of these other agencies and regulations to make sure that all the processes are going smoothly. So it works with other food safety programs such as Good Manufacturing Practices, which is the GMP, and also Sanitation Standard Operating Procedures. So these three in general kind of always go hand in hand. And all these protocols are required in federally inspected meat and poultry operations and other products, as well as to ensure clean facilities, clean equipment, and even clean employees. So HACCP was invented in 1959 by the Pillsbury Company. If you don't know who the Pillsbury Company is, they make food products. And you might have seen them around. You see the Pillsbury Doughboy, you see biscuits, you see cookies. So a lot of raw food types. And this was created by Pillsbury Company to produce a microbiologically safe food product, specifically for NASA space flights. And if you look at history, usually just when we're talking about going to the moon, just kind of around the JFK era and that general time period in history. So it wasn't actually introduced to the public until 1971 because it was a fairly difficult system and they just kind of felt like it was too much for the public to understand. And then they just decided to go on and let it be publicly known. Today, this is considered one of the most effective ways of ensuring food safety. And I believe in the 1990s, it was the most efficient way. The most effective way to ensure food safety. It was like number one in food safety protocols. So there are a couple of steps. Some have 7 points, there's 12 points depending on the program. Usually what you see is a 7-point plan, but these are the steps that you have to go through. You assemble your team, you describe your product, you identify your intended use of said product, you construct a diagram, confirmation of a flow design. So all of those in some points kind of all go hand in hand. This is just a little more detailed step procedure. You list all your potential hazards. You determine what you would do, your critical points, establish a monitoring system, establish a corrective action in case you do have a foodborne illness or you do have some kind of hazard that comes up in production, a verification process, a corrective process, and you establish documentation and record keeping. And record keeping is primarily for this is how it happened, this is what happened, and goes into detail about how your corrective plan may or may have worked, and as well as just about any corrective issues along the way to make it a more efficient program in the future in case it occurs again. So there are 7 critical control points. Control point 1 is conduct a hazard analysis, and really what you just need to do is make a list of your significant hazards and the hazards you may have to deal with, some that could prevent it or eliminate it, how you control them in a plan. Justification for including or excluding the hazards reported and possible control measures are identified. You've got number 2, which is identify the critical control points. This is your CCP. This is a step or procedure at which a control point can be applied and a food safety hazard can be prevented. So what we want to do is prevention and not aftercare. That is the goal when it comes to our raw food and our safety products. You want to eliminate or reduce to an acceptable level. Number 3, you've got to establish critical limits. And a critical limit is the maximum and or minimum value to which a biological, chemical, or physical parameter must be controlled at a CCP to prevent, eliminate, or reduce an acceptable level the occurrence of a food safety hazard. So your critical limit is usually measured by time, temperature, water activity, pH, weight, or some other measure depending on specifically what that product is. Number 4, you've got your monitor CCP. So you need to monitor that critical control point, and measurements will be taken, and that measurement should be taken frequently and recorded during the entire production process. So just keeping an eye on that critical control point. You've got number 5 next, which establishes a corrective action. So in case you do have a hazard that comes into play, you need to have a plan for how to correct that and how to avoid it in the future. That's specifically one of the most important parts. So after that, you've got verification. So activities other than monitoring that determine the validity of the plan and that the system is operating according to the plan. So you need to verify and prove that the HACCP plan works. It works for you, it works for your company, and it keeps food safe. So after that, you've got your record keeping, which again, if there was, a hazard or something happened, how did you handle that? Did it work? How can you be better in the future? How can you avoid having these problems again? And just keeping an eye on that. So who uses the HACCP? From what I read, quite a few places, almost pretty much everywhere that we have raw food or we have food production in general. So I listed off just a few of them to kind of see the differences about what they're doing and how they put these plans in action. You've got your dairy grade A voluntary, which this is a group that voluntarily follows HACCP regulations and work well with other plans and regulations to make sure that our dairy is up to standard. We talk about dairy, we talk about eggs, yogurt, milk, ice cream, cheese, anything that comes from a cow and you see in your dairy aisles is what they consider to be a dairy grade product. Juice is juice, retail and food services. So we've got your actual food industry. There are HACCP plans there in place as well, because you've got retail and food industry where you do have to do a lot of raw foods. Your seafood, so anything that is sea related, and your meat and your poultry. So the dairy grade A volume is the guidance of the National Conference on Interstate Milk Shipments. They evaluate, monitor, and enforce dairy safety as alternative to traditional inspection, rating, checking, rating system. From read about the traditional system, it was okay, but they still had a lot of missed products coming down the line that probably shouldn't have been on shelves. So they are very consistent and up to date with all HACCP recommendations and ensure that we are producing the same quality level of milk every time. So all jugs, all gallons of milk, all packs of butter or cheese should be the same kind of quality when we put them on the shelves and they're in the grocery stores. And really encourage uniformity under the HACCP alternative as opposed to your traditional system, which, like I said, going down the line and reading about it, it just seemed that they were missing the mark on that. That just wasn't happening. We weren't having uniformity. We weren't having a quality level of production that consumers were accustomed to. So your juice HACCP, this also works with the Food and Drug Administration and the Food Safety Modernization Act, and rules and regulations require juice producers to notice safety hazards that can likely happen to juice products when they are processed and help create a safety plan that does not halt further contamination, or that does halt further contamination. So raw juice products that come straight from fruits or vegetables, last thing you want is those fruits and vegetables to have some kind of food disease that can potentially be in that product and get consumers sick. So some specific regulations that I thought were interesting is that it requires that juice importers of specific juices, and I couldn't get a list of which ones, but that some specific juices must comply with specific rules to help make sure that the imported items are processed according to HACCP regulations, USDA regulation, FDA regulations. So any kind of juice or fruit or vegetable that we're importing to make juice needs to meet all these requirements before we're putting these products on the shelves. Next, you have your seafood HACCP, and this requires seafood producers to identify and regulate seafood safety standards, requires importers of particular seafood products to comply with specific requirements since the goods are imported. So pretty much the same way that we do our juice importing, we want to make sure that these products are safe and that they are reliable. There's a very uniform product that we're putting on the shelves for consumers, whether that be raw shrimp or that be imported orange juice. After that, we've got our retail and food services. Retail and management positions are a large factor in regulating, controlling regulations in that industry. So hospitality and the food industry. And so your management, even your staff at some level, your waitresses, your busboys, whatever you're looking for in your food industry, at mass production like that, there needs to be a level of understanding of these rules and regulations on all levels. And regulators and management work together to account for different varieties of food prep and services. So obviously restaurants do with a lot of raw food, but there's also getting food from the hot plate to your customer. And you can even potentially, if someone didn't wash their hands right, get a disease in the process along that way. So just making sure that every step, the way that your food is handled and taken care of correctly, so that there are no diseases and no hazard contaminations that you have to deal with, and hopefully you don't get sick. So in the poultry industry, meat and poultry products are extremely sensitive, especially when they're raw, and can be proven to contamination. Contamination that they can get are bacteria, viruses, and parasites. So we've all heard of salmonella, and a couple of other diseases that are going on that you can see. And this is a problem because these infected products can result in a foodborne illness. So if you eat one of these products and it's got a contamination, you can get extremely sick. I know I personally have gotten sick from a couple of places, and it was from their meat. So I don't know how that was mishandled along the way, but watch out for it, I guess. In 1996, the USDA passed a regulation called FSIS, Pathogen Reduction, and HACCP regulation. So by passing this, it required that all meat and poultry plants to implant and put HACCP into use within their operations. So any meat and poultry plant that we have in the United States is HACCP regulated. And if this contamination regulations fell on the industry and not so much the USDA. So what they mean by that is if there was a disease or there was a hazard or contamination, specifically the USDA is not to blame. However, that production facility might be, because they should have been following their 7-point critical care plan, and they should have been making sure that HACCP was in place and people were following the regulations that come with that. So again, today we see this in all of our industries, in all our meat industries, and obviously there's no way to completely eliminate all hazards. Things are going to slip, mistakes happen. I mean, if you've got people on the line, people make mistakes. That's just part of the industry. But it does help control the production process. And the beauty of HACCP is the fact, or HACCP, excuse me, is the fact that you should be aware of it. And so you should be able to spot a potential hazard in real time and not after the fact. So that's where we see this come into play in our poultry industry and our red meats and anything similar to that nature. So how does this differ from traditional food safety and food systems? It differs because it puts more ownership responsibility on the food processors to identify and stop and control any potential food hazards. So not so much on the USDA, like I said, but on your facility, on your company, on your employees. And it will also document the effectiveness of the system. Requires constant updating. So they're constantly making adjustments, constantly trying to make this a system as efficient and as good as it can be, and make sure it works. Last thing we want is a whole bunch of sick people. So how much authority does the regular agency have when it's adopted? They don't lose their authority. They are still very much in charge of their facility and in charge of their products. They maintain their authority and they oversee their authority and they oversee production. They also oversee HACCP regulations. So they are now in charge of making sure that they're following those regulations as well. It does allow more flexibility to use resources wisely instead of standard for regulators to have a set standard of food safety. That is a big goal with HACCP, from what I've learned, is that it needs to be an efficient and a uniform product every time we're putting a product on the shelves. Every time there's a product on your plate, every time there's a product in your grocery store, it needs to be of the same quality of the last product you buy and the next product you buy. So, advantages. The food safety system is enhanced primarily by being proactive in monitoring the food being processed. It is important to document the result and any corrective actions that are being taken place in the process. And like I said, the monitoring is in real time. You're being monitored by your employees, by your management, by people on the line, by waitresses, and not an after the fact approach, which is what helps to make the process easier and more efficient. By monitoring in real time, it is easier to catch any mistakes or problems. So if we see one product that might have a hazard, we're going to stop the line, we're going to stop production of that product and make sure that the rest of them don't, and try to actively correct the situation before we produce more of that product. So why does it work? It works because it requires monitoring in real time. Again, that's the most efficient part of this program, is the fact that we're seeing our products and we're checking them along the way before they're packaged, before we put them on the shelves. And when food safety limits have been violated, it means a contamination. So there are steps in place to correct contamination. There are steps in place to get control and reinstate your safety for your consumers, for your employees, for everyone involved in the handling of these products. And there are documented procedures that are done to help prevent events from happening again. So, like I said, that's a really big part of that record keeping. You want to make sure that you write all of this stuff down. You have documentation about what's going on. So the next time, if it does happen again, you know how to handle it. You know how to avoid the situation. And if it happens again, you're ready for it. You can shut it down a lot quicker than the first time you did, because now you not only do you recognize it, but you've got systems in place as well, which is extremely important. And again, the system is constantly being updated and verified to make sure there are no mistakes or safety issues. So it's constantly getting updated to make sure that we don't miss anything. Something new comes along all the time. No one was ready for the coronavirus, but it happened, and people adjusted. And a lot of people have adjusted really well. And you've got scientists who have stopped and worked on vaccinations and things like that. So kind of in the same sense here, you're seeing it in real time and you are reacting to it as it happens and not later. So that is the HACCP. If you have any questions, you can email me. That's fine. I love to answer them. My T2L email is probably there in the email list. And that is the end of my presentation. Thank you.